Morning, everybody. It's a pleasure for me to be here, and thank you so much for the invitation. My talk today is about innovation solution in breast milk banking and handling. My name is Aleksandra Wesolowska, and I have a double affiliation. I am working on Warsaw Medical University. I am leader of research group focused on human milk and lactation. And I am also a president of Human Milk Bank Foundation, which is an NGO organization supporting breastfeeding with special emphasis to provide human milk, including donor milk, to the NICU. And I have no conflict of interest to declare. Innovation in neonatology, like surfactant and non-invasive respiratory support, may allow great progress in neonatal care and increase a chance of survive very teeny baby. But as was mentioned before, presence of mother, kangaroo care, and also breast milk is crucial for long-term prognosis of this baby. And in fact, is challenging in case of preterm baby. Of course, the own mother milk, especially given by breast, is an optimal choice. But for some cases, the only minimal enteral feeding is needed. And when baby is too small to suck stronger, it's also difficult to provide breast milk. And in such case, the express mother milk is a choice, and even a donor milk. And I would like to, and it is the reason that in the area of modern neonatology, we need to focus of breast milk handling and banking. And by this presentation, I would like to draw your attention to several important issues in this field. First of all, I would like to talk a little bit about the availability and indication of donor milk. Later on, I will give you some of the need and example of innovation in this field. And finally, I would like to talk about challenging and opportunities for innovation results from globalization and also digitalization of healthcare system. Provision of donor milk is in line with WHO organization recommendation, which state that for low and very low birth rate infants, donor milk is first choice when the mother milk is not available. But not only a preterm infants may benefit, also the critical ill-term infants born and term required surgery. And what is especially true last period after the outbreak of Ukrainian war, also child affected by crisis and orphans could benefit. In case of the mothers, of course, the first choice is the mother who willing to breastfeeding, but have not enough breast milk during the first days after birth, despite lactation support. But donor milk may be also help when the mother is absent due to the separation, sickness, and even death. And the donor milk could be also provide as a bridge to own mother milk, and when the breastfeeding is contradicted transit, because, for example, for such a medication that it is opposite to breastfeeding. My question is, do you use donor breast milk in your neonatal unit? fantastic. I am very happy that we can share experience. A lot of people have experience with donor milk. I am very happy to see. In fact, the number of donor milk bank is have been increased for the past few years. Nowadays, we have 700 milk banks operated in more than 60 countries. 2025 operated in Europe with the largest number of Italy, Sweden, and France, and most of them are associated with European Milk Bank Association. I have a privilege to be a member of the board of this association, and I am strongly encouraged to be also involved. The next question is, how easy is for your natal unit to assess a human milk bank? You are lucky. A lot of you have the regional or your own milk bank in the unit. Yeah, there is a different strategy, but in Poland we have a network of human milk banking operated regionally, and I can see that it is the most favorite option for in this audience also. Yeah, but the situation is not similar when we are looking at the map. When the number of milk bank is presented for per 100,000 premature birth, we can see that in some region like Africa there is no data, but a lot of region is colored by light blue, what means that the number of milk bank per 100,000 premature baby is not above 10. And the last data collected from 400 units from 100 milk bank revealed that over 800,000 infants worldwide receive donor human milk, among about 50 million infants are born prematurely each year. So still, human milk bank is in demand worldwide. But not only the number of milk bank needs to be increased, also a technology used by them. And the key process in human milk banking is pasteurization, because it ensures the safety of milk. And the most common use pasteurization is a holder pasteurization, when we keep the liquid milk in bottle, in water bath for 30 minutes in temperature above 60 Celsius degree. And of course, this procedure ensures safety of milk, because it's kill almost all vegetative form of bacteria and virus. But on the other hand, because the need of defrost and frost milk again, and also because putting in the water, this procedure also pose a risk to milk contaminated for outside bacteria. So this is the reason to some innovation. There is a very cute new water-free breast milk pasteurizer. And as you can see, this pasteurizer is working with frozen milk that can be put in a small bag without opening the bag. So it is very clever solution that avoid contamination risk, minimize the loss of nutrition due to the prolonged repeated head treatment, and also reduce effort of the staff. Nevertheless, always when the milk is heat treatment, there is some losses in nutrition and immunoglobulin and immunoactive component. And some of them are completely removed, like IgM antibodies, immunosol, digestion enzyme, and another is partly changed, like cytokine, growth factor, secretory immunoglobulin, lysosome, lactoferrin. But fortunately, some of them are unchanged. And I would like to stress that even though there is some losses after the heat treatment, still donor milk is better than formula. But for sure, we need something new in this field. And based off the last recommendation from European Milk Bank Association, the new technology should be at least as effective in microbiology safely as Holder pasteurization, but we would like to improve, especially in the preservation of bioactive factors. And also, this new technology should be tested in real working condition and not just a pilot study. Our, wishful thinking is that we would like to have efficient, cost-effective, and able to scale up equipment to milk bank setting. And there are several technology under investigation. The most promising is thermal ultrasonication, ultraviolet C radiation, microwave radiation, high temperature short time pasteurization, and high pressure processing. I will focus on high pressure processing because it is very well known technology from food market. You can even buy the high pressure seafood, meat, or juice. And what is a huge advantages of this technology that food preserved but by this way keep the taste, flavor, and texture comparable to fresh food. Also, microbiology safely is enabled to keep it, and vitamins and nutritional characterization of fresh foods is very similar. And bioactively is close to fresh product and long time preserved. The work done by my team was conducted in a huge consortium. We are working together within the few research entity, including Warsaw Medical University, with cooperation with NGO organization led by Human Milk Bank Foundation. And we use the high pressure not above 600 megapascal. And as you can see, we miniaturize the equipment for high pressure because in the food market, there is a huge equipment, but we finally could minimize this equipment to reduce the cost and effort, and also to make this enable to use in daily routine in milk bank. And at the beginning, we focus on the effect of high pressure of two important immuno component of milk, IgE and lactoferrin, and also several hormones, leptin, adiponectin, IGF, and insulin. The results that you can see in this table are presented as a retention percentage compared to the content in raw milk, but the impact of high pressure we compare to the standard procedure recognized like Holder pasteurization. And we test several variant of high pressure, including 2 shots of high pressure. And you can see that this variant, when 200 megapascal was followed by 400 megapascal, was more effective to preserve this important immunocomponent and also hormones. In the next step, we analyze the effect of this selected variant to lipid profile. We choose also lipase activity because it's crucially important for preterm baby to have access from this enzyme from mother milk. And fortunately, we're very happy to see that our selected variant didn't impact the activity of this lipase, excuse me. And also you can see that lowering of free fatty acid in case of this selected variant is not so much. So we are very happy to have some condition preferable that holder pasteurization of this new technology. Finally, we decided to following the high pressure by lyophilization. Why? Because we are almost sure that it may be preferable for the baby to have possibility to adjust the water to milk, to adjust volume of water to the need of baby. And there is another strong argument because lyophilized human milk don't need the freezer. And maybe it sounds like a food technology, but it is well known from other research that lyophilization could be useful in case of human milk because the macronutrients it's stable after lyophilization. The microbiological safety is kept. And also what is very important, a lot of bioactive components can be active after a liquid was put in lyophilization human milk. You can take into consideration that some micronutrients are changed. So it is especially important when we are thinking about feeding the baby. Finally, the clinical research is needed to done to recognize the safety and effectively of this technology. But as I said before, it is not really innovation because lyophilized human milk was introduced in the first milk bank organized in Vienna in the last century. After that, also in Boston Floating Hospital, lyophilized human milk was widely used. But as you can see, the equipment is very complex and huge. And because of this, most human milk bank give up with this procedure. But what is interesting, there is one milk bank in France, in the city, small city Marmande, that have provide lyophilized human milk from the from the several years until now. Nowadays, the product lyophilized human milk is available on demand. There is a lot of advisement in the internet, and there is the service when the mother can give the bottle with their own milk, and the company give back the lyophilized human milk. The problem is it's very expensive. It's cost more than $200 per 100 milliliter. And my opinion, it is very controversial because of the risk of commercialization of human milk. Let's move to the UK, to the Hertz Milk Bank, which is located near the London. It is very extraordinary unit. It is unique unit because they cooperate with the patient outside the hospital, and they provide the donor milk across the whole of the country. As you can imagine, the transport of milk from such a long distance, it may takes even more than 24 hours, even though they use the motorbike to avoid the crossing jam. And several in this process to provide donor milk from unit to patient need to very stable, consistent temperature. And because of this, they use Internet of Things and big data to monitor the safety and quality of donor human milk during the transport. Each transport bag has a 12 sensor, which monitoring the humidity and temperature. Data are collected throughout all of the transport. Data was transmitted to the cloud, processing, storage, and finally the alarm arrives. Even in case the temperature increase above -20, and this message is sent straight to the via email or via smartphone message straight to the person which is as responsible for such a transport. So it is very, very useful and clever solution to be sure that temperature is transient along all of the transport, not in the beginning and in the end. The next huge challenge that we face in human milk banking is the adapting the constitution components of donor human milk to the needs of the preterm. And this is the reason that there is the field of innovating research. And I would like to present you one of the global study that I have taken part. This is the research funded by NIH and PATH organization. And the aim of this research is to provide the profile, the global profile of content of donor human milk based on the data from 8 human milk bank worldwide, from low and high income country, based of the biorepository from more than 600 sample donor from donors. Our first results confirm a huge variability of nutrients in this global profile. And as you can see, the least variability is related to lactose, but the much more variable is biotin and other vitamin. But what is really important, the basic nutrients component like protein is also very, very different between the sample. But the goal is not only to analyze this variability, but also to characterize, to understand how we can minimize this diversity and how we can adjust the composition of donor human milk to a preterm baby need. And there is two main strategies. to do it. It's a kind of in any case, it's a kind of the pooling the milk. But one strategy is pooling the milk is a target pool, which pool donation based on the macronutrient content of a sample of donation measured by human milk analyzer. And another strategy is select donation randomly, or considering factor not to affect the composition of milk, such as infant gestation age and donor lactation stage. And in this context, researcher from Toronto, using the machine learning strategy to predict the content of macronutrient in pool. It was used the model training using individual donation level, and data source was 272 individual donation and 61 pools sample from Ontario Human Milk Bank. And finally, 4 different machine learning models were constructed using independent data associated with donation, donors, donor pumping practice. And finally, they can predict the macronutrients to optimize the pooling decision, and finally optimize the content of pool. And 1 year implementation project, it's a pilot project revealed that pools created by this approach meet clinical macronutrient targets approximately 31 more often than the baseline, and taking 60% less time. So it is very promising strategy, I think. Yeah. And last but not least question, what needs to happen to make breast milk more accessible in your union, in your country? Will be some clouds, or maybe you can express your feeling. Yeah, encourage donation. Yeah, I think education is a very important issue. And in fact, by recruiting the donor, we always educate mothers. Yeah. Yeah, financial support is a very, very important issue also. It is not very popular that milk bank, even own mother milk, is reimbursement. I think it's a very few European countries have such a solution. Yeah. Yeah, it's very interesting, your idea. I need to implement a lot of them, I think. Yeah, logistic between bank and center, it's also an important issue. Yeah, let me show the global perspective. I really believe that we need to consider human milk banking as a part of ecosystem. And I think it is especially important in the era of digitalization of medical data. And this concept is stated by PATH. It is the international organization that support implement human milk banking globally. And we believe that integration and digitalization of data from human milk banking to the whole ecosystem, first of all, provide a longitudinal record of donation and tracks mother and baby pair over time, even record over multiple pregnancies. So on the other hand, we can expect if the mother is a good candidate to become donor, or maybe the mother need help and need be supplemented by donor milk. And also such a thinking and integrated this in the whole system enables traceability of donor milk from donor to recipients, what is crucial, important for safety. And also, I really believe that in such a thinking, it's make us enable to organize the field for the new innovation, like mobile maps for mother, mobile apps for donor, and also not waste the time to doing some of the examination again and again, because some of them is already done in an OBG section, and it is not need to do some of the examination and the stage of recruiting the donor. So I am really looking forward such solutions, such implementation. And by the end, I would like to also be very honest with you and say that although the number of human milk bank in Europe increasing, we have no global guidelines of human milk banking. And I am very happy that now WHO working on such a global guidelines. And these guidelines will be based of the honest science, based of the systematic review and comprehensive analysis of available scientific evidence of this topic. And I am honored to work with two very important questions with other experts. First question is about the impact of health and growth outcomes of child-fed donor milk depends of varying lactation stage, health condition of donors, expression practice, and preservation technique. And another important question that we would like to explore is the impact of health outcomes and growth of infants fed with their own mother milk according to the using different practice of expression and methods of treatment. Until now, we did a search over 40,000 abstracts to find the relevant paper to deeper analysis. So results is coming very soon, but please finger cross because it is very huge work. And I would like to thank you for your attention, and also let me ask to donate, because every drop of milk matters, and we would like to make more of them. Thank you so much.